Hi, my name's Allison, and I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you may have.
Thanks so much. I look forward to learning a lot. So you're taking care of the patient in room 313.
Mm-hmm.
Do you have time to give me a report?
Sure. Jesus Garcia, room 313, 28-year-old, no known allergies. He's a full code Hispanic male. His doctor is Dr. Levin. His diagnosis is dehydration and ulcerative colitis. His complaint, he came in complaining of nausea and vomiting and weakness. He was admitted for nausea and decrease of oral intake in the past 5 days. History of left-sided colitis, had elective colectomy and transverse loop colostomy 15 days ago. He's awake, alert, and oriented ×4. Perla is intact, speaks English. He moves all extremities, gait steady. Cranial nerves 2 through 12 are intact. Strength is 5 and 5 in upper and lower extremities. His lungs have equal breath sounds bilaterally. Clear to auscultation and percussion. No crackles, bronchi, or wheezes are noted. He's negative for JVD. Rate is normal. Rhythm regular. Pulses are 2+ bilaterally at radial and dorsalis. Pedal pulses. Heart sounds are normal. S1, S2 without a murmur, gallop. His bowel sounds are hyperactive in all 4 quadrants. Abdomen is soft, flat, tender. Stoma, he has a stoma on his lower right abdomen, and it is pink and moist and perfused. Both openings are functional. Mucus output is noted from distal site, and proximal stoma opening exhibits liquid brown effluent. He's on a clear liquid diet. He self-voids. So his skin is pink, warm, and dry. The only thing, he does have the ostomy with 2 openings on his stomach. His vital signs are within normal range, and he's got an IV site in his right median vein. And the doctors just gave a verbal telephone order for vancomycin because he was just diagnosed with C. diff.
Okay, thank you so much for giving me your report. Do you mind if I ask you a few questions about the medications administration and then watch you demonstrate giving the medication in the patient's room?
Not a problem at all. What do you have?
Why specifically is he receiving this medication, and what action does it have on the body?
Well, the client's receiving vancomycin because he has C. diff, and this is an antibiotic, so it inhibits the bacterial RNA and cell wall synthesis. It alters the permeability of bacterial membranes, causing cell wall lysis and cell death.
When should you question administering the medication? Does it have a therapeutic serum level? Which vital signs should be monitored? Which physiological parameters should be monitored when it's being administered?
You want to continue to monitor all the vital signs, heart rate, respiration rate, pulses, fever. You want to monitor labs, albumin. If he has cells in his urine, there may decrease the specific gravity. You want a complete blood cell count and renal function, and it may increase the Bund levels. You want to question, okay, that's good.
Okay. Are there any interventions that should be taught to the client to ensure the medication is administered safely in the hospital setting or at home?
You want to make sure that he's giving the right medication at the right time. This is by mouth, so he doesn't crush or crush the medication, that he takes it whole and he takes the whole medication.
Okay. Are there any side effects or potential adverse reactions?
Side effects are chills, dizzy, vertigo, hypertension, nausea, ototoxicity, nephrotoxicity, wheezing, pain, anaphylaxis.
And how will you know that the medication is effective?
It will decrease the signs and symptoms of an infection, and he will be negative for C. diff.
Okay, perfect. Thank you.
Are there any more questions? before we go to administer the patient their medication?
No, thank you so much for answering my questions.
Not a problem. It's important to know your patient and the medication you administer to keep your patient safe. Okay, let's see. Hello, knock knock. Oh, I've got 5 minutes. Can you pause? Thanks, Sue, and